One of the main concerns individuals often have is how dural sinus thrombosis will affect their health. The symptoms of this condition can vary greatly depending on factors such as the location and extent of the clot, but they commonly include severe headaches, vision problems, seizures, and potentially even coma. It is important to note that these symptoms may develop gradually or appear suddenly. The dural sinuses serve as crucial conduits for transporting the deoxygenated blood out of the brain and back to the lungs, where it can be refreshed with oxygen once again. They are located within the protective layers of the meninges, which enclose and shield the entire central nervous system. The intricate arrangement of these sinuses allows for efficient drainage while minimizing any disturbance or interference with the delicate structures of the brain. One type of severe condition that can affect these sinuses is called dural sinus thrombosis. This refers to the formation of a blood clot within any of the dural sinuses, such as the superior and inferior sagittal sinus, superior and inferior petrosal sinus, transverse sinus, sigmoid sinus, or straight sinus. Initially, this excess blood may not pose an immediate threat as the small veins in the brain can expand to accommodate it. However, as more blood accumulates, pressure begins to build up within the limited space of the cranium, skull. This increased pressure can compress and damage delicate brain tissues. When arteries rupture, they release blood into areas where it shouldn't be, disrupting normal functioning. The bleeding that occurs can create a variety of problems in the brain, depending on its severity and location. In some cases, it may result in a smaller hemorrhage that causes minimal damage or symptoms. However, others may experience more significant bleeding, which can lead to serious complications. In some cases, dural sinus thrombosis can lead to paralysis of one side of the body, similar to a stroke. This occurs when the clot blocks blood flow to certain areas of the brain responsible for motor control and sensation. Other neurological symptoms include seizures, which result from abnormal electrical activity in the brain due to reduced blood flow. Benign intracranial hypertension refers to increased pressure inside the skull without an underlying tumor. Its symptoms often mimic those of dural sinus thrombosis, including persistent headaches and blurred vision. In both conditions, individuals may experience a feeling of pressure behind their eyes or ringing in their ears. It's crucial to note that dural sinus thrombosis can be life-threatening if left untreated, since it involves the formation of blood clots that impede proper blood flow and oxygenation to the brain. A brain CT scan, also known as computed tomography, utilizes a combination of X-rays and computer technology to generate detailed images of the brain structure. The scan provides vital information about abnormalities or injuries, allowing healthcare providers to make well-informed decisions regarding appropriate treatment options. One of these tests is magnetic resonance venography, MRV, which is similar to a traditional MRI. MRV provides detailed images of the veins in the brain and skull, allowing doctors to visualize any blood clots present in the dural sinuses. It's a non-invasive procedure that uses magnetic fields and radio waves to produce clear images. Brain bleeding caused by dural sinus thrombosis can exert pressure on vital structures within the brain, potentially leading to long-lasting impairment or even fatality if left untreated. The compression of essential regions can disrupt normal brain function, resulting in neurological deficits and cognitive impairments. Heparin is a medication administered through injection or intravenous infusion, and it works by preventing the further formation of clots. It does so by inhibiting certain clotting factors present in the blood. This helps to minimize the risk of new clot development and also prevents existing clots from growing larger. The first goal of these medications is to prevent further enlargement of the existing blood clot. A growing clot can impede blood flow, increasing pressure within the blood vessels and potentially causing damage to surrounding tissues. By using targeted medication, healthcare providers work to limit such enlargement and minimize any harmful effects it may have on brain function. The process of breaking up these blood clots typically involves the use of specialized medical devices or techniques. These interventions aim to dislodge or dissolve the clots, facilitating improved sinus function and relieving associated symptoms. However, it is important to note that these treatments are considered experimental and are only available at select institutions. Risk factors for dural sinus thrombosis can vary. Medical conditions like pregnancy and puerperium, oral contraceptive use, head trauma, infections such as meningitis, and systemic conditions like thrombophilia have been identified as potential triggers for clot formation. Additionally, certain lifestyle choices and habits play a role in increasing the likelihood of developing blood clots. During the last trimester of pregnancy, women face higher chances of developing certain conditions that can increase their risk of stroke. Conditions such as high blood pressure or preeclampsia can accelerate the clotting process and impede normal blood flow to the brain. It is crucial for pregnant women to monitor their blood pressure regularly and seek medical attention if any concerning symptoms arise. Matthew, thank you for spreading awareness, and I hope this video reaches a broad audience.